What if your body has been quietly warning you about diabetes, and you have been missing the signs every single day? Long before any blood test, long before a diagnosis, the clues can start showing up in a place most people never think to look: your feet. And what I am about to share today may completely change how you recognize early warning signs in your own body. Most people believe diabetes only shows up in lab results. You visit your doctor, run some tests, and then you find out. That belief is common. I have heard it from countless patients over the years. But here's the truth. Your body often starts sending signals much earlier. And if you know what to look for, you might catch it before it ever shows up on a report. I am Dr. Grace Adebayo. I have spent over a decade as a physician working closely with older adults, and I have sat across from far too many patients in their 60s and 70s who told me the same thing. They had no idea. They felt mostly fine. They were not particularly thirsty or tired, but when they finally came in, their diabetes had already been silently damaging their nerves, their blood vessels, and their kidneys for years. Today, I want to give you something that most routine checkups never cover: a head-to-toe examination of what your feet can tell you about your blood sugar. Not medical jargon, not a list of complicated terms, just clear, honest information that could protect your health, your independence, and your life. Stay with me, because the 9th sign on this list is the one I wish every single senior knew before it was too late. Diabetes does not announce itself loudly. It does not knock on the door and introduce itself. In many people, particularly adults over 60, it creeps in quietly. The blood sugar rises slowly over months and years. The body adapts. You feel something is off, but you chalk it up to age, or a bad night's sleep, or just getting older. By the time many people receive a formal diagnosis, the disease has already been present for an average of 4 to 7 years. Think about that. Years of elevated blood sugar, silently damaging the smallest and most delicate blood vessels in your body. And where does that damage show up first? Almost always in the feet. Your feet are the furthest point from your heart. The circulation there is the most vulnerable. The nerves that run all the way down from your spine to your toes are among the longest in your entire body, and that means they are among the first to be affected when blood sugar stays too high for too long. According to the Centers for Disease Control and Prevention, more than 37 million Americans have diabetes, and approximately 1 in 5 of them does not even know it. Among adults over 65, the numbers are even more alarming. Nearly 29% of that age group has diabetes. 29%. That means almost 1 in 3 people over 65. And the complications that come with unmanaged blood sugar are devastating. Nerve damage, reduced circulation, non-healing wounds, in the most severe cases, amputation. The American Diabetes Association reports that every year, more than 100,000 lower limb amputations are performed in the United States related to diabetic complications. Most of those could have been prevented, caught earlier, treated in time. That is why we are having this conversation today. Let me explain what is actually happening inside your body when blood sugar stays elevated, because once you understand the mechanism, the warning signs make perfect sense. Think of your blood vessels like a garden hose. When the water running through that hose is clean and flowing freely, everything works beautifully. But now imagine that water is thick and sugary, sticky. Over time, that stickiness coats the inside of the hose, it narrows the channel, it damages the walls. That is essentially what excess glucose does to your blood vessels. It damages their inner lining. It makes the walls stiff and narrow. Blood cannot flow the way it should. Now the feet, being at the very end of that circulation system, are the first to suffer. Less blood reaching the feet means less oxygen. Less oxygen means damaged and dying nerve fibers. It means wounds that cannot heal because the healing factors in your blood simply cannot get to the site fast enough. Doctors call the nerve damage peripheral neuropathy, and the circulation problems are called peripheral arterial disease. Both are incredibly common in people with undiagnosed or poorly managed diabetes. But here is the critical point. Both of these problems start producing signs and symptoms long before they become severe. Your feet are showing you a window into what is happening in the rest of your body. In my years of treating patients, I have learned that the most powerful tool we have in medicine is not always the lab result. Sometimes it is simply paying careful attention to what the body is already trying to tell us. So let us talk about the 9 warning signs. And please, as we go through each one, think about your own feet. Think about what you have noticed recently and perhaps dismissed. Sign number 1, persistent numbness or tingling in the feet or toes. This is usually one of the earliest signs, and it is one of the most commonly ignored. People describe it as a pins and needles feeling, a buzzing sensation, or the feeling that their foot has fallen asleep but never quite wakes up. This happens because elevated blood sugar damages the protective coating around nerve fibers, called the myelin sheath. When that coating is damaged, nerve signals become distorted. The nerves begin misfiring, sending sensations that feel like tingling or numbness, even when nothing is physically pressing on the foot. Here is why this matters so much. Numbness is not just uncomfortable, it is dangerous. When you cannot feel your feet properly, you cannot feel when something is wrong. A small cut, a blister, a stone in your shoe, without sensation, these small injuries go unnoticed and become serious infections. If you have been noticing tingling, buzzing, or numbness in your feet or toes for more than a few weeks, do not wait. That is your body asking you for help. Sign number 2, burning pain in the feet, especially at night. This one surprises many people because they expect diabetes-related symptoms to feel like numbness, not pain. But in early nerve damage, many people actually experience heightened and abnormal sensations before numbness sets in. The burning is often described as a deep heat inside the foot. Some patients tell me it feels like their feet are on fire, particularly when they lie down at night. This happens because damaged nerves misinterpret signals and send pain messages unprovoked. If you are waking up at night because your feet feel like they are burning, that is not something to brush off. That is your nervous system telling you something is wrong. Sign number 3, slow healing wounds or sores on the feet. This is a critical one, and I want you to pay very close attention here. Normally, a small cut on your foot heals within a week or 2. When blood sugar is chronically elevated, that healing process slows dramatically. High glucose impairs the function of the white blood cells that fight infection. It stiffens the blood vessels that deliver oxygen and nutrients to the wound. And it reduces collagen production, which is the material your body uses to seal and rebuild damaged tissue. A wound that should heal in 10 days might take 6 weeks. And during that time, bacteria have a warm, moist, glucose-rich environment to thrive in. If you have a cut, blister, or sore on your foot that has been there for more than 2 to 3 weeks without significant improvement, this is not normal. Please see your doctor. Sign number 4, dry, cracked skin on the heels and soles. I know this sounds like a minor cosmetic issue, but hear me out, because this sign is more important than most people realize. Elevated blood sugar damages the sweat glands and oil glands in the skin. This leads to skin that cannot retain moisture properly. The result is excessive dryness, flaking, and eventually deep cracks, particularly along the heels. These cracks are more than unsightly. They are entry points for bacteria. And in a person with compromised circulation, even a small crack in the heel can lead to a serious infection. If the skin on your feet feels persistently dry, tight, and rough despite using moisturizer, this is worth discussing with your doctor. It may be more than just dry skin. Sign number 5, changes in the color of your feet or legs. Healthy feet have consistent color. When circulation is impaired, color changes begin to appear. You might notice your feet look pale or almost white when elevated. You might see a bluish or purplish tint when your feet are hanging down. Some people notice their feet flush red or dark pink when warm. These color changes reflect the blood vessels struggling to regulate circulation properly. In some cases, you might also notice a dull, brownish discoloration around the ankles, which is caused by small amounts of blood leaking through damaged vessel walls and pooling under the skin. Any new or persistent color changes in your feet should be evaluated. Sign number 6, cold feet even in warm weather. This is one of the signs that gets dismissed most often. People say, "Oh, I have always had cold feet. It runs in my family." And while some people do naturally have cooler extremities, persistent coldness in the feet that is noticeably worse than the rest of your body, particularly when accompanied by other signs on this list, can indicate reduced blood flow from damaged blood vessels. When arteries that supply the feet become stiff and narrowed from years of high glucose, less warm, oxygenated blood reaches the feet. Cold feet. Particularly if one foot is significantly colder than the other, this should be discussed with your doctor. Sign number 7, swelling in the feet and ankles. Swelling in the feet and ankles can have many causes: heart issues, kidney problems, medications, but it is also directly linked to diabetes and the kidney and circulatory complications that come with poorly managed blood sugar. When the kidneys are damaged by chronically high glucose, they begin retaining fluid that should be excreted. That fluid backs up and pools in the lowest points of the body, your feet and ankles. Additionally, damaged blood vessel walls become leaky, allowing fluid to seep into surrounding tissues. If you notice that your feet or ankles are consistently puffy by the end of the day, or if pressing on your ankle leaves a dent that takes time to spring back, that is called pitting edema, and it needs medical evaluation. Sign number 8, thickened, yellowing, or brittle toenails. Diabetes weakens the immune system and impairs circulation, and both of these changes make the feet far more vulnerable to fungal infections. Fungal nail infections, known medically as onychomycosis, are significantly more common in people with diabetes. The nails become thick, brittle, discolored with yellow or brown tones, and may start to separate from the nail bed. Beyond being uncomfortable, these infections can spread to the surrounding skin, creating cracks and open wounds that are difficult to heal. If your toenails have changed in texture, color, or thickness, even if it seems like a minor cosmetic issue, it is worth having evaluated, particularly in the context of other symptoms on this list. Sign number 9, loss of hair on the feet or lower legs. I saved this one for last because it is the sign that almost no one knows about, and yet it is one of the most telling early signs of serious circulatory impairment. Hair follicles need a rich blood supply to function. When circulation to the lower legs and feet becomes significantly impaired, the hair follicles are among the first things to stop receiving adequate nourishment. The result is gradual hair loss on the tops of the feet and lower legs. If you look down at your feet and notice that the fine hairs that used to be there are gone or significantly reduced compared to the rest of your leg, this is a sign that the blood supply to your feet may be seriously compromised. I have had patients tell me they assumed the hair just fell out with age. But when combined with cold feet, slow healing, or color changes, loss of hair on the feet and lower legs can be a sign of peripheral arterial disease, which is strongly associated with diabetes. This is the sign I mentioned at the beginning, the one I wish every senior knew about. Because when I ask patients about it and they suddenly look down at their feet in the middle of my office and go quiet, I know they have just connected a dot they never connected before. Let me tell you about a patient I will call Harold. Harold was 71 years old when he first came to see me. Retired engineer, sharp, thoughtful, very deliberate in the way he described his symptoms. He came in because his wife had noticed that his feet looked different. She had seen some information about foot health and something nagged at her. Harold himself felt mostly fine, a little tired perhaps. He had noticed some tingling in his right foot for a few months, but had attributed it to sitting too long at his desk. He assumed it was a circulation issue from being sedentary. When I examined his feet, I found dry, cracking skin around both heels. His toenails on the right foot were thickening and slightly yellowed. The hair on his lower legs had thinned dramatically, something neither he nor his wife had noticed. And when I checked the temperature of his feet, his left foot was noticeably warmer than his right. I ordered blood work. His fasting glucose came back at 228. His A1C, which measures average blood sugar over 3 months, was 9.4. Harold had type 2 diabetes. He had almost certainly had it for at least 4 to 5 years based on the level of nerve and circulatory changes already present. When I told him, he sat very still for a moment. Then he said, "I had no idea." That sentence, those 4 words, are the reason I make content like this. Harold went on to manage his diabetes with medication and lifestyle changes. The tingling improved. The skin on his heels healed with proper care. His circulation numbers stabilized over the following year. He never needed a hospitalization. He never needed a procedure. But what struck him most, he told me at a follow-up visit 6 months later, was that his body had been telling him something was wrong. He had just not known the language. That is what today is about, teaching you the language your body is speaking. Now let us talk about what you should actually do with this information. First, examine your own feet today, not tomorrow. Today. Look at the color, the skin texture, the nails, and the hair on your lower legs. Feel whether both feet are the same temperature. Press gently on the top of your foot and see whether you feel sensation normally. This takes 2 minutes, and it is one of the most valuable 2 minutes you can spend on your own health. Second, if you recognize 2 or more of these signs in yourself, make an appointment with your doctor this week and be specific. Do not just say, "I think something is off." Say, "I have been reading about early signs of diabetes and I want to check my blood sugar, my A1C, and I want my feet examined." That directness gets results. Third, ask for the right tests. A fasting blood glucose test tells you your blood sugar at a single moment in time. But an A1C test gives a picture of your average blood sugar over 3 months. It is far more revealing. If you have not had an A1C checked recently, ask for one. Fourth, if you are already managing diabetes, your feet deserve a dedicated examination at every medical visit, not just a quick glance, a thorough check including sensation testing, circulation assessment, and skin inspection. You have the right to ask for this every time. Fifth, do not wait until something hurts badly before you act. One of the cruelest features of diabetic nerve damage is that by the time pain becomes severe, the damage is already significant. The goal is to catch this early, when the body is still whispering rather than screaming. And here is one simple habit that can make an enormous difference. Every night before bed, remove your shoes and socks and take 30 seconds to look at your feet. Both sides. Between the toes, around the heels. Look for any new cuts, blisters, sores, or discoloration. This one habit, practiced consistently, has prevented amputations. I mean that literally. If this video is giving you information that feels valuable, that feels like something your doctor should have told you but never did, I want to ask you to subscribe to this channel right now. Every week, I share honest, practical, research-based health guidance made specifically for adults over 60. No fluff, no fear-mongering, just the truth your health deserves. Hit that subscribe button and ring the bell so you never miss a video. I want to close by saying something directly to you. You have lived a full life. You have worked hard, taken care of others, navigated challenges that most people will never face. You have earned the right to age with dignity, with independence, and with your health intact. Diabetes does not have to rob you of any of that. Caught early, managed well, it is a condition that millions of people live with and thrive despite. But caught late, after years of silent damage, the story can look very different. Your feet are not just your foundation, they are messengers. And today, I hope you have started to understand what they might be saying. Do not be like the patients who sat in my office and said, "I had no idea." Be the person who looked down, paid attention, and took action. Now I want to hear from you. Look down at your feet right now, or think about what you have noticed recently. Has anything on this list caught your attention? Have you dismissed a tingling, a slow healing sore, or a patch of dry skin that was actually your body trying to get your message through? Tell me in the comments. I read every single one, and your experience might be exactly what someone else needs to hear to finally take action. If this video helped you, please share it with someone you love. A spouse, a sibling, a friend who has been feeling off but cannot quite explain why. One share might be the most important thing you do for them today. And subscribe if you have not already, because next week we are covering the blood sugar warning signs hiding in your hands and eyes that most people are completely missing. Your body is already talking to you. The only question is whether you are listening. Everything I have shared today is general medical information based on published research and my clinical experience as a physician. It is not a substitute for your own personal medical care. Every person's situation is unique. Before making any decisions about your health or seeking diagnosis, please have a thorough, honest conversation with your own doctor. They know your full history. They know your body. And that conversation, taken seriously and unhurried, is exactly where good medicine begins.